Hi, my name is Dr. Savak Teymoorian. I'm a glaucoma-cataract specialist. I work in private practice at Harvard Eye Associates in Laguna Hills, California. At the end of the day, whether we're ophthalmologists or optometrists or any other type of doctor, the quality of life for our patients is the most important thing. That's why we take care of them. Although we perseverate on what happens to the intraocular pressure, really that's the end goal. Jumping back to the thought process of improving quality of life, SLT is a good option for patients because it eliminates eye drops for most patients. And what does that mean? You're eliminating the cost burden, the fact that they have to remember it, and the fact that they have to execute it during the day. The other thing to remember is when you're doing an SLT procedure, patients have really good coverage with their intraocular pressure. So that means you're going to have less of a disease progression. What that means is at the end of life, you have better vision, and better vision results in good output and good quality of life at the end. Anytime we're trying to decide how to treat patients, we always think about risk to benefits, because that ultimately dictates which options we should do, one or the other. To me, the risk profile of an SLT is very good. In fact, when my patients ask me, is this a dangerous thing to do? I usually tell them, I think your eye drop's more dangerous to your eye than the SLT. There are several key benefits that SLT offers over medications. The first thing is non-adherence and that issue in and of itself. The big problem with medications is patients simply don't get the drops in. There are many different studies that show how compliance is actually quite poor at the end of 1 year, even though they're using just one medication. Well, if the patient isn't getting their medication in, the disease is getting worse. The other things that make SLT superior to using medication is the side effects or the lack of side effects. Once you're done doing the initial laser application, the patient goes home. There's no increased redness or irritation every time they have to put the eye drops in. The other part of it is we always seem to forget, when you put an eye drop in, it's different than using a medication. It's not a pill you just pop in and that's it. There's actually an execution part of putting the eye drop in. Think about your elderly patient, which is more likely to be affected from glaucoma. The ability to squeeze properly is very important. And then you add in the difficulty with many different types of generics. The bottles change month to month. It's a common concern I hear all the time. Hey doc, beginning of the month, the medicine floods out and at the end, nothing comes out. And then I go to the pharmacy to refill my medicines and they tell me it's too early. Either I have to pay the full price or I'm simply out of drops. Both of those options are unacceptable. When people think about having to use eye drops, at first they think it's a benign thing, but in reality, there's a lot of side effects that can occur. Even with a prostaglandin analog, hyperemia is an important thing. Whether you're a young adult or an older senior, having red eyes is a problem. Even beyond that, whenever you need adjunctive therapy, there's systemic side effects we can be very concerned about, including beta blocker effects, which can affect the heart and the lungs, along with other issues that can come up, allergies related to certain medications. The fact of the matter is, the eye drops, although they do work well, they're not benign. They do have some risks involved that need to be taken into account. Everybody has a little bit of a different post-op regimen. For me, once we're done with the procedure, I don't give any extra medications, maybe just some lubricating eye drops. I typically see the patient back about 2 to 3 weeks later. We check the pressure of the first eye, and if applicable, we then perform the laser procedure in the other eye. See them back a few weeks after that, and they're set back to normal routine visits.